Welcome back. We have a doctor from Hoag Vascular Services Program, Dr. Ehab Mady. Good to have you here, sir.
Thank you. Thank you for having me.
And tell me first about the Vascular Services Program at Hoag.
So, Hoag has a vision to provide services to patients with vascular disease. And the idea behind the program is to start thinking beyond the ability of an individual physician to serve the patient. How about if a large institution capable with a lot of resources bring physicians together, create programs that can serve the patients at a much higher level through coordination of care, multidisciplinary approach where multiple physicians from different backgrounds of training come together to serve the same patient. The idea is population health, serving a community rather than serving just individuals meeting their own physicians. When the physicians come together, supported by systems, it helps them actually provide much higher level of care.
Sure. And what are some of the things that you cover when you're talking about the vascular system? That to me is really throughout the body.
Yes.
Is there a few specific things that you deal with?
We can think of it in a very simple way. The vessels in the body are artery, the artery that takes the blood from the heart everywhere else to distribute the blood everywhere else. The vein is the blood vessel that take the blood back to the heart. And there's a third vessel that is not as commonly known called lymphatic vessel, which carries a different type of fluid other than blood, the lymph fluid. We're all familiar with the lymph nodes that sometimes swell up when we have infection in a tooth. This is the lymphatic system, and it drains a different type of fluid. But these are the three vessels in the body. Any disease that can impact any one of them is called a vascular disease.
Okay, so that could entail, shrinking of the arteries, or hardening of the arteries, or
Correct.
anything like this, or some sort of restriction in any way.
Correct. You're absolutely right. It's the most common known disease to man. The disease that impacts vascular vessels, the arteries in particular, the cholesterol, the plaque that causes the arteries to be narrow. We all know that this is the #1 cause of death everywhere in the world, especially in the Western world. So we're talking about a very common problem that almost impacts every household that you know. If it's not me, it's a family member or a neighbor or a friend.
Sure. What is PAD?
PAD is peripheral artery disease. Peripheral artery disease, so we're talking about the artery. Peripheral is a word that means opposite to central. What is not central is peripheral. Central, we think, is the heart.
Okay.
So the coronary vessels, we're all familiar with the coronary vessels getting disease when people have heart attack.
Right.
That's central. That's a disease entity by itself. If we look into the vessels away from the heart, vessels going to the brain, to the arms, to the legs, to the intestine and the internal organs, these are all categorized under the word peripheral artery disease.
Okay.
The most common use of the term has to do with the lower extremity vessels, because most of the time this is how patients present. They present with leg pain when they walk, and it's a common thing, and many people will have it, and sometimes we don't know if it's my ankle, if it's my knee, it's a muscle, or it's a chronic disease that I have like rheumatoid arthritis or something else. But sometimes we think it's just my age. It's okay to have leg pain every now and then, but we need to think about this very serious disease, peripheral artery disease, can simply present with leg pain with walking.
Okay, and it sounds like a type of disease that could end up in a blood clot or possibly even causing a stroke, right?
You're absolutely correct. Why it's important to think about my artery that's going to my leg. Sometimes we think, oh, am I going to lose my leg? Actually not. Actually, if we look at the data, 1 of every 5 seniors will have this disease, so 65 and above. 1 of every 5 people, 65 and above, will have peripheral artery disease. And if we have a patient with peripheral artery disease that present with leg pain with walking, because there's a problem with the leg to the artery to the leg, only 1% of those patients will have a risk of losing their leg, but up to 20% may have a heart attack and stroke. And within 5 years, 15 to 30% may die from heart attack or stroke, may die from
Wow.
a serious vascular disorder. So every time I see a patient, I remind myself that 1 out of 5 of those patients that become very dear to me, if we live together for 5 years, I may lose one of them.
Wow.
And the battle here
Yeah.
is not only to lose the limb, but also not to lose a life.
So, what is some of the causes of this, particularly when people have leg pain? You mentioned things like maybe knee pain or leg pain or even arthritis. Are those all connected? Is arthritis separate than that, or is the vascular problems turning into things like arthritis or other diseases?
That's an excellent question. The arthritis is mainly a joint disease.
Mm-hmm.
The vessels supply the joints as well as other organs. So definitely low blood flow to the joint can cause joint symptoms. But the reason patients present with leg pain when they walk, if they have peripheral artery disease, is very similar to the chest pain when we walk if we have coronary artery disease. There is a muscle that is working harder, requiring more blood flow, and that unmasks the problem. If I am sitting at rest, I need a little bit of blood. What is flowing is enough for me. But once I need more than the resting level of blood flow, the problem will appear. I don't have enough blood flow to go through a narrow artery, so my muscle starts to hurt.
Okay.
Now, if I ask you this question, which muscle you prefer to start hurting first? Your calf muscle or heart muscle?
Yeah.
I would take the calf.
Yeah, exactly.
So it's in a way, much better for me to realize that I have this disease through pain in my calf when I walk and start reversing the course of the disease, or at least holding it back before it reaches my heart, or before my heart problem can become manifested with a heart attack or something like this.
So tell me about the walking program at Hoag, the PAD walking program.
One of the amazing things that clinical trials showed us over the years, that when patients have problems with circulation to their legs and narrowing of the arteries to the legs, the first line of therapy doesn't have to be a surgical intervention. It doesn't have to be a bypass surgery. It doesn't have to be a stent. Bypass surgeries and stents are essential and important and available at the highest level. And they serve the patients to save their limbs and their lives sometimes. But before we consider going to the last resource to treat the patient with peripheral artery disease, the first line of therapy, according to national guidelines, for patients with claudication, which is the term that describes leg pain with walking, is walking program. And this is a very specific intervention. It's not just simply tell the patient it's good to walk every day, or you need to walk 15 to 20 minutes every day. It's a very specific protocol, well studied in clinical trials. It's about 1 hour of walking, including rest periods, where patients will be initially evaluated to see when they walk, when they start feeling the pain, how far they can go before they cannot stop because they cannot go any further because of the pain, their heart rate, their blood pressure. And all this is monitored very closely by nurses who are trained, exercise physiologists who are trained to deal specifically with patients with PAD and claudication. If patients enter a program like this, it's usually 6 months, 3 times a week, patients walking on a treadmill. At the end of the program, one of the clinical trials looked at specifically patients with disease that impacting the iliac artery, the external iliac artery, the big artery that goes from the pelvis to the leg, and compared if we put a stent to open up the artery versus having the patients walk in the walking program for 6 months. And the patient who did actually walk for 6 months in the walking program did better than the ones who got the stent.
And far less invasive, obviously. Yeah.
Definitely. I encourage everybody to consider this first as an option. And our experience at Hoag in our program, we have the only program in Orange County. And this program is really made to serve patients by providing them with this opportunity to have this option. It's not available anywhere else. And this is an opportunity for the patient to consider it before going further in the line of available interventions for therapy. we see things that we didn't even consider as part of the benefits of the program. For example, when patients come together and they start walking, it develops a community, it's
Sure.
a culture. They start talking about stopping smoking. They start talking about losing weight. They start talking about leading a better, healthier lifestyle. They actually help each other during difficult times. Some of our patients lost a loved one during 6 months of therapy. And they talk to each other. They build this relationship. Some of them are asking to continue after the 6 months, coming as a gym membership. And we're offering them,
Nice.
You're welcome. You can come for a maintenance program. The data from clinical trials are surprisingly pleasant, because we just had publication of 18 months follow-up to the same study that I mentioned to you. It's called the CLEVER trial. 18 months follow-up, I apologize, 18 months, 1.5 years after the end of the initial study, to look at the same patients 1.5 years later, and they still did better than the
Wow.
group that had the stents. So whatever benefits the patient get during the 6 months, continue with them even 1.5 years later. They don't have to continue walking, but if they do, it's better for them.
Let me ask you about how someone may determine they have this problem. Is it just a chronic leg pain, like a dull ache, that is not related to anything? And what I mean by that is, we all wake up one day, we have sore muscles, and we can go, oh, well, I worked in the garden all day yesterday. I went out and played tennis. There's a correlation to why that is happening, and after a day or two, you know, your muscles feel better, they loosen up. So is this something that people will just feel almost all the time throughout the day?
Not exactly. This
Okay.
is an excellent question. Anything to help patients understand what could be happening with them is definitely helpful. This usually presents, the most common presentation, with what feels like cramping when I walk.
Okay.
Not at rest. And it's always after the same distance. So patients will come and say, I walk half a block and my leg starts to hurt.
Okay.
It most commonly cramping, but it can feel like burning sometimes, or achiness, or heaviness.
Does it move? The pain move around?
No, it's usually the same area. It
Okay.
can be the calf, can be the thigh, or sometimes the buttocks.
Okay.
And it feels the same, always after the same distance. And they always say, as soon as I stop, in a minute or two, the pain goes away, I feel better. And I can walk again. And it's the same distance.
Interesting.
This is very classic for peripheral artery disease.
Okay, that's good to know. Great information, Doctor.
Thank you.
It's been a pleasure to have you here today, and you've really given some great information here, and most importantly, what the viewers can kind of look for if they feel they may have a problem here. So, wonderful information.
Thank you very much for having me.
And you work out of, you were saying Newport, but also the Irvine location as well?
Yes, the Vascular program is located in the main hospital in Hoag, Newport Beach, and also in Hoag, Irvine.
All right, very good. I want to give you the number, 949-631-6002. Dr. Mady, thank you very much. It's been a pleasure.
Thank you very much for
All
having
right,
me.
nice to meet you.
Same
We'll
here.
be right back.
Thanks.